Well, hello again, everybody. My name is Marty Guthmiller. This is a special uh, community briefing today. We have with us Dr. Meis, our resident pediatrician, and we're very grateful that you're here. Thank you for being with us today. We thought it would be good to ask Dr. Meis to come in and just talk a little bit about something she knows a lot about, kids. And particularly with school coming up, particularly with obviously this thing called the coronavirus, and just talk a little bit specifically about kids today. And so, Dr. Meis, let's just talk a little bit about it. What do we know today about the novel coronavirus? How is it affecting kids? Are kids good viral transmitters? What percent of kids typically get ill? If so, how are their symptoms manifested? You know, that kind of thing. And I'll come back and fill you in with a few more questions if I threw too many at you.
Sure. So, we're definitely learning a lot about this new coronavirus. From the beginning of everything starting up, we've found that kids, thankfully, are not affected as severely as some of the older population or those with multiple medical comorbidities, which is good. Certainly, there's the concern with school starting up where, could they be asymptomatic or just have mild symptoms and be, super spreaders. I think in general with pediatrics and kids, they do tend to spread germs more regularly than adults do, but the same recommendations apply with any illness or virus where we recommend that they're washing their hands, covering up coughs. Certainly the masks have been a newer thing that started up in the last few months, but those are all good ways for them to just prevent any spread if they would be asymptomatic carriers. As far as the numbers go, from what I've seen out there, majority of kids, 80+% are going to have just mild respiratory symptoms like maybe fever, cough, some possible difficulty with breathing, but a lot of them may not even have any symptoms. Certainly there are the smaller percentage that could develop more severe symptoms, but thankfully that's the exception more than the rule. It'll be an interesting process for everyone going into this new school year and deciding if they should send their kid to school or not. And I think everyone will be a little bit more cautious going into things this school year, where if they have any fever or a temperature over 100.4 Fahrenheit, that may be a reason to keep them home from school, just because we want to really minimize the spread and minimize it getting to the higher risk populations. I think that's the biggest goal in all of this, is trying to keep our higher risk populations healthy.
I think, this is a little different format here today, and so we can maybe be freer, if you will. One of the questions that I've had has been a burning question as a Minnesota Twins fan. As the Major League Baseball teams and players have tested positive, I kind of want to know how many of them actually got sick. And so I think if you take that back into the elementary schools as an example, I think it's good for parents to understand, see if you agree with this, that it's not so much the number of positives that we have, it's whether or not kids are getting sick. And historically, what we've seen so far, as you mentioned, that the likelihood of kids getting really, really sick is really, really low. And for example, as I shared in my briefing earlier, there have been 0 deaths in the state of Iowa in the under 18 age category. And so that's again one indication that maybe this doesn't affect kids as severely as those with comorbid conditions. Right?
Yeah. That's what we're finding. Obviously, it's still new and we're still learning a lot about it. And I know in the news a few months ago, they talked about that multi-system inflammatory disorder that
Right,
sometimes
right.
happens in kids, but honestly, that is very rare. So obviously something for us to keep in mind and watch out for, but not something that happens very often.
Again, that's probably something that happened in kids before COVID,
Right.
as
Yes.
well, right?
Yes. Mm-hmm.
So let's talk about, you briefly mentioned it, but masking.
Yes.
What's the word out there on masks for kids?
Yeah, so the biggest thing is, if kids are going to be in closer contact with each other where they can't practice that social distancing of 6 feet or more, that, it would be better from a asymptomatic spread standpoint to have them wearing a mask. That does not apply to young children who are less than 2. They just have a hard time understanding masks. And some of the younger kids are going to be pulling at the mask and touching their face and probably causing more spread just from the mask itself than you'd get from the protection of the mask. But I know the different schools around here are kind of following different recommendations and different guidelines, but we would say that especially if they're going to be sitting closer areas, maybe on the school bus or closer in a classroom where they can't space them out as well, that a mask would be beneficial. From the American Academy of Pediatrics standpoint, they've talked about, the 6-foot rule. Even if you have contact with someone, but you're 6 feet away, you may not be considered exposed. That rule can be shortened to 3 feet if you're wearing a mask. So there's benefits of masks. I know that it's a hot topic and you get different opinions depending on who you ask, but in general, it's there to just kind of protect against any sort of asymptomatic spreading, to protect others.
Thanks. When I admit, when I think of a pediatrician, I think of a doc taking care of little kids. Mm-hmm. But I know pediatricians, you go up into the teens, right?
Yeah.
All right. So let's kind of walk through those two different, the smaller kids, younger mm-hmm. kids, and let's break it this way: elementary versus high school. Okay, mm-hmm. So let's talk about elementary first.
Yeah.
And so as parents are considering sending their child to elementary school, and I would assume that we would support that we would encourage that, mm-hmm. But you can affirm that.
Yeah.
What are things parents should be thinking about as they go through that decision?
Right. And so I think the schools are doing an awesome job keeping those considerations in mind, because that's a unique part of pediatrics where it's not just one size fits all. You very much have to tailor it to the age of the child. And the school system recognizes that, kindergartners are not going to understand this as well as our seniors in high school. And the bottom line is that, every child tends to do better learning in person than in the online environment. Certainly high schoolers may do better online just with the setup that they have. Some kids can do assignments online and send them in virtually, but certainly kindergarten online format is not as friendly as the in-person format would be. And so from the grade school standpoint, they talk about, having the necessary precautions with the understanding that they're not going to be able to fully understand everything. So I think the schools are doing a great job of keeping those things in mind. Like for recess, they may have the kids play closer, play in certain groups or in certain areas of the playground so that they're not having this widespread, normal recess that we know and love of everybody everywhere and touching everything. I think that the schools are going to have plans in place where they will have, maybe one classroom is on this part of the playground and another classroom's on that part, and just keeping it a little bit more separate and spread out. And again, like I talked about with the masks, maybe wearing masks at certain times when the kids are definitely going to be close together, but it may not be plausible for them to wear it all day long and not touch their face and touch other things. So
yeah, as a grandparent to several, I would think that would be a challenge
yes.
too. So I would assume all the normal things about immunizations and all that, keeping the engine tuned.
Yeah.
I mean, all those things are still critically important.
Very much so. Yeah, they've actually put out more of a drive from the American Academy of Pediatrics with getting kids in for those well child checks. It's very important for them to stay up to date on their immunizations, and prevention is kind of our main goal. And that's the goal with COVID too, and the goal with other diseases that they can get. So that's why we recommend staying up to date on those immunizations.
Yeah, just like we tell everybody out there, the other diseases of the world have not taken a break.
Right.
They are still out there. And even if the numbers or the reports of those are down, it's not because they went away. It's just that because they aren't being diagnosed. And so please do that with your kids. Please keep them up to date. And, if you're the mom and you're getting your family, make sure dad gets in too. All right. So we talked a little bit more there about the elementary schools. But what about the high school kid? What about, band and volleyball and football? Is there anything special that you would say there, or again, follow what the school's saying? Those people can be a little bit more directed, of course, but also a little more free-spirited.
Yeah, so that'll be a challenge. I think, the schools, again, are doing an awesome job working together and kind of having multiple people involved with the health system and the school nurses and the teachers. And it's going to take multiple people and multiple ideas to really come up with the best way to get kids back learning. But certainly, we know it's important for them to be in schools. They get lots of other benefits from school that you can't offer in the online environment. Social development, emotional development, very important things that we get in school interactions. And so, that's a big piece of why we are doing the sports and the music and everything, that kids can get a lot development-wise from those activities. And again, it may be a challenge to determine the best way to keep them socially distanced or to keep them from spreading germs. But the biggest things are just making sure they're cognizant, making sure that they're washing their hands, making sure if they don't feel well that day that they should stay home.
And, if nothing else, maybe some better hand hygiene for the rest of their life stays with them.
Yeah.
And so I think just a couple, take-home messages. And we're going to have Dr. Donlin, I think, come talk to us one of these days too. But you touched on it a little bit, that the importance of, we believe that it's important for the kids to get back to school. We believe it's safe for the kids to get back to school. And we're willing to help and do whatever, but we really think you need to stay in the game. We really would encourage everyone to get kids back in school, get life back to some degree of normalcy again. And we'll follow up in the next week or so with Dr. Dowland too and talk about it. But again, in summary, immunizations, well child checks, get kids back to school. Maybe don't freak out when there's that first positive test. Try to keep in mind the fact that kids, generally speaking, do much better than grandpas and grandmas out there.
Yeah.
And try to keep that in perspective. Is there anything else that you'd like to add for today if we covered the basics?
Yeah, I feel like, we've covered most of it. Just again, to refresh, is that we do recommend that kids get back to school. It's, like I said, the in-person learning environment offers a lot of additional things that you can't quite get online. Certainly everybody's keeping tabs on this on a daily basis, and the schools will especially be keeping a close eye on it. So if we get into a situation where, cases are rising really high, or there is an outbreak in the school, then I'm sure they have the proper protocol and action to take place just to minimize spread. And, if we need to do a little bit more online learning like last year, then, they will do that. But obviously there's so much that kids can gain from being in school that I think that's best to get them back there.
Good, thanks. And that's a good reminder. Everything we're saying today doesn't assume that there's zero positive tests. It assumes there's going to be some, but it also doesn't assume that we're saying go no matter what.
Right.
You know, obviously, if there's some major outbreak or something changes in the world that's unforecasted, unpredicted, that kind of thing, of course that changes. But based on what we know now, based on what we see now, and based on what we expect to see, this is the advice that we're giving today. So thank you, Dr. Meis, for joining me today. I'm sure the viewers out there are greatly relieved to see somebody else besides me. And so thank you all for joining us today. Again, I appreciate Dr. Meis joining us, and we'll look forward to other visits like this in the future. So thanks again.